specifically as a volunteer supervisor. It's not so much my position, but I think I'm going to talk about healthcare as a whole, because there's something that I saw coming in 10 years ago that my brother was the catalyst, as I spoke earlier, that moved me in this direction. And my advice to anybody coming into healthcare is to learn more about mindfulness. So if they could take a mindful caregiving class, that's important. There's too much disconnect between the caregiver and the patient. I'm teaching that to the pre-med students now. And one of my students became an end-of-life doula, and he's learning more from that than he did in a textbook. So he's laying the foundation for his path as a professional, and I think it's going to change the way that he looks at healthcare as a whole, but then also how he interacts with his patients to come. Definitely the mindfulness. Also, because we're so disconnected with technology, we need to take care of ourselves, because if we don't take care of ourselves, we can't take care of somebody else. And it's something that I've been working towards, especially in the last year, working on my own self-care practice. It's just not going to happen. It's not going to work. We're going to find ourselves burnt out, and there's going to be too many problems that are going to stem from just not taking care of ourselves. So if there's anything, take care of yourself, be kind, and definitely look into self-care practices, whether it's yoga or a mindful caregiving course online, or find a health and wellness center and learn either holistic practices. I'm also a Reiki practitioner and certified. I learned that about 6 years ago, and I used it on the patients while they were dying. And to me, that helped them create a more tranquil and peaceful death.